Hi everyone, welcome back to Living with Anxiety, Panic, and PTSD. I'm Enrique and I'll be your host. Today I have a special guest to chat about what it's like to live with a family member who suffers through anxiety and panic. Go ahead and introduce yourself.
Hello, my name is Belladonna. I am 19 years old, and obviously, I live with someone who has panic attacks.
So, um, as far as you remember, like how far back can you remember me living with this stuff, or is that like? Because I know you were pretty young when I started. Um, well, when I realized I had it,
Hmm.
like how much of your life do you remember with me having it?
So honestly, I don't remember like the first 5 years of my life. So if you showed any signs, I like didn't pick up on them. But I do distinctly remember like when we moved up to the Bay Area, and you went to the hospital with John,
Right.
and that was the first like big moment that I was like, oh, something's happening. Like there's something going on with him that is like um, is affecting obviously his day to day life.
Right.
But before that, I do remember like mentioning to you like, hey, like I feel like this way, and you're like, oh, that yeah, I feel the same way. And it's like when we're usually in malls or like crowded parks, stuff like that. It was like uh, I would mention something to you and then you bring it up to me. It was never like I just picked it up. It wasn't so obvious that I just
So I did pretty good at hiding it
until a certain point,
until a certain point.
obviously.
Yeah. So when I went to the hospital with John, that was I think 2012. Um, Pretty late in 2012. And yeah, that's the first time that I think that I remember that I wasn't able to control it very well. Like most of the other times, I would feel the symptoms, and I'd be like, okay, I can get through this. I've got stuff to do. How has the knowledge of knowing that your dad gets ill, how has that kind of affected you or your view of me?
I mean, it hasn't really affected my view on you. It's more of the idea that it's nice knowing that it can really just happen to anyone. Like it's not growing up. Obviously, we're in a more accepting time nowadays where people are more open about stuff. But growing up, there was obviously a big stereotype on people with mental disabilities where it's like, they have they're so weird, they're outcasts, they have all these things wrong with them, they're weird. And knowing someone close to me who was going through it and seeing like, he doesn't act like that, that's not him, he doesn't look like what people are portraying as these people, is it really, put into perspective that um, you know, everyone kind of has something to say when they don't really know what's going on.
Okay.
Like they kind of like to overgeneralize when they probably shouldn't be.
Right. Um, Knowing what you do about what I live with, does it change kind of how you approach communication with me or the things that you tell me about or talk to me about?
It doesn't change the topics that I talk to you about, but it does make me more aware of what's happening. So I think of it as like a game in a weird way where there's a meter. So if I see certain like movements or behaviors where it's like I can kind of see that you're starting to feel you're approaching like a panic attack or you're feeling anxious, then I'll try to figure out what it is that I'm saying or what it is that's happening that I might be able to alleviate what's going on to either help you or probably just calm down the conversation. Like maybe it's too much. Maybe we should wait for another moment to continue what's going on because right now is not the time.
Right. So you feel you can still be pretty open with me. You just have to figure out like how much of it you can talk about in one shot.
Yeah, it's just making sure that you're not being constantly put in a position where it would trigger what's going on.
Okay.
Like it would be kind of fucked up if I knew what was triggering it, and I'm just like, let me just keep doing it and see how far I can take it. Like,
Right. So, what types of signs do you look for when you think that I'm moving more into an anxious zone? Like, what are the things that you look out for in me to kind of give you guidance into, okay, maybe we should slow it down or step back from these topics?
a big one that is very obvious would be movements. So, throughout the day, you can be seen like, um, balancing your leg, but usually when a conversation gets, there's two good things. So if you're getting really into it, you could be bouncing your leg out of like excitement, but sometimes you can just tell when it's out of being anxious. Also, there's times where you just start, playing with your hands more, or you'll start like rubbing your head more, depending on the conversation. And so movement is a big one. It's obviously the most noticeable one. Another one would be like, this is kind of weird, but like eyes, like you get less engaged. Like, more, you're at the beginning when you're, really into it. You're very focused. You're looking me in the eyes all the time. But as you start disconnecting with what's going on, you're kind of like, obviously rubbing your head, but you're like looking around more. You're like, taking time to like away and be like, okay, okay, I'm thinking. But it's not so much engaged. It's more of taking your own time to be in your space and, kind of, checking out.
Okay. And those are your two biggest ones that you kind of notice? And when you see that happen, do you feel like I'm probably not going to remember half of what we talked about after I start feeling like that? Or do you feel like the message is still getting there? I'm just not.
I can just assume that you're not going to remember half of what we're talking about without any of that.
Why is that?
Yeah, I mean, you just forget. Or you're not listening because you're just like, that's pretty cool. Like I don't take any foul feelings to it because like it's like when it just happens, I'll just either remind him or it's not important enough to remind him about. Like that's all it is.
Okay. If let's say there's some people that are watching and they also have children who are about your age and they haven't had a chance to maybe have these conversations or they've been hiding it like I did. What would be your advice for them to like open up that conversation? Like how would what do you think would be make it easier for a person of your age, to listen to a loved one or hear from a loved one, hey, I'm going through this.
Wait, are you asking advice to the parent to help them open a conversation, or
Well, yeah, because if they have children your age, right?
Age.
Yeah, if they have children your age, that's who they're going to approach. Like, what would make it easier for that a person your age to kind of accept that communication or be ready for that communication?
A lot of it does depend on like your already pre-established relationship, because if you are not a family that already communicates, it will be very weird and in a way like kind of not frightening, but like it would make you paranoid if like all of a sudden it's like, oh my god, they're coming at me, they're trying to communicate, like what's going on, like you're gonna question it rather than like accept what's going on.
Okay.
So you'll be on the defensive, rather than just like trying to hear out what the parent would be saying. But past that, I would just say like try to relate to your child, like be like, has this happened to you, that kind of stuff, or don't be afraid to like show that you have that, because a lot of the time I think parents, they want to be that perfect person for their child. They want to be like, I'm amazing, I'm the best, you should aspire to be better than me because
Right.
I'm so good, you want to be better than me, and that's awesome. You do want to set a great example. However, if let's say your child is also suffering with it, if they look at you and they see you don't break a sweat ever, that could be very discouraging to them. So you opening up and be like, hey, like I'm human too. Like I'm going through stuff too. This is what I'm going through. This is like how I cope with, like, being very open and honest about what you're feeling, what you're going through. Because if you try to play it off like, yeah, I go through it, nothing to me. I don't really care. That's gonna put off the whole conversation, and you're not gonna go anywhere with it at all.
Right. So knowing that I live with this stuff, how does that make you think about, you know, your own life? Like, knowing that I'm the one, part of who raises you and teaches you behaviors, right? Does it make you think that, I'm teaching you bad behaviors, or maybe I'm influencing behaviors that could lead to this in later years? Or do you just think this helps maybe to your benefit, knowing, what to look for and how to talk about these things?
So I'm not gonna lie. Overall, I don't really think about it. Like I'm not, at work and like, oh my gosh, my dad has a mental disability. Like that doesn't happen. I think overall, in general, you raising me though has definitely influenced me to be more, open to what's happening to people. I feel like I'm the only word I can think of is sensitive to like picking up people's behaviors, and like I want to understand why they act that way. If someone is, being quiet in a group, like I want to understand why they're pushing themselves away from someone. I want to help them get back into the group if it's just being shy, or maybe they're disassociating. Like I want to figure out what the cause is, and I want to do my best to help them. I feel like you being so open with me about mental health has definitely given me the tools to like be there for someone if they need it, but also give them space if they don't want me around,
Right.
Like knowing where the line is, not trying to push myself onto them so much to the point where it's making it worse.
Right. Okay. So overall, you think that me being so open with you about, what I live with has improved our relationship, or has it, like in the future, maybe if you decide to have children or whatever, right? Like you're gonna look back on how you were raised, and what your parents were like, and I'm gonna be part of that example set. Like, have you thought about, how our relationship has been, and what impact it has had on you in terms of, because you mentioned earlier that, parents try to be this perfect example of things, and I'll be honest with you, I don't try to be that. Like I know I'm not perfect. I'm faltering all kinds, and I think that's the point of why I'm so honest with you. I want you to understand that nobody is.
Right.
Do you think that's helped or kind of hindered your image of what a parent is supposed to be like, or what a parent is going to, represent?
I think it's definitely helped because, I mean, you're not the only parents I have access. Like, you're my parents, but
Right.
I have cousins, I have friends. I see how they all interact with their own parents, how their parents interact with their parents, and it doesn't stop with just, my relationship with you. I can see everyone else's relationship, and like that image definitely, I've seen many people try to do that, and for the most part their relationship isn't really doing that well, and I can't help but feel like me knowing that you don't have to be perfect, especially as a parent, has definitely helped. I feel like I just wanted to say
No, no,
I
no.
kind of lost my train of thought halfway through there.
It's okay. I mean, I got where you were headed, and it was a good explanation, a good summarization of your thought. I guess before we go, I wanted to ask, like, what tips maybe you could give for, maybe a child or a loved one who's dealing with somebody who's facing anxiety and panic. Like, what would be, let's say, your top 3 tips on how to interact with them or how to behave around them to kind of um, help them maintain. Because the reality is, you're a support system for me, right? You're a person in a support position,
Mm-hmm.
and it really helps me a lot to know that you understand what I'm going through, and you're not only doing things to help me um, navigate through those things, but you also have that in your mind that am I adding to this effect?
Right. I don't know if I can do three. If I can do one,
Okay.
I can't do three.
Do one then.
I know for sure. Like the biggest one I can like the as you're speaking, this one popped into my head immediately, and I feel like it has to be the most important if it popped into my head like that. But it's just you assuming that it's this type of relationship, family relationship. You know that person. You've grown up with that person, and finding out that they have a mental disability doesn't change anything. You know who they are, uh, as who they are.
Right.
They are not their mental disability, so you know how to interact with them. I think a lot of the times people hear that someone has a mental disability and they think that they have to start walking on eggshells, and they start acting in a way that makes things worse because the person that they're walking around, they notice, they're not going to be
Right.
like, whoa, what's going on there, like they see what's happening, and sometimes that can make it worse for them because it could make their brain think like, what am I doing, start
Right.
questioning themselves and stuff like that. So just remember that at the end of the day, you are someone that they care about, and whatever way you feel would support them in the way that they are would be great. So like if you're great at baking, you don't have to go up to them and be like, hey, let's bake together. You can bake them cookies and just gift it to them. Like do what you can for them. Don't force something that would make it unnatural.
Right.
You
Like an
know that-
awkward
yeah.
an awkward feeling because why are they giving me these? Why are they having me cook with them
Yeah.
when I never cook with
Yeah,
them?
like just just keep doing your thing, and be ready to be there if they ask for it. Like don't feel like don't put on a big show and be like, oh yeah, I got you. I've been looking up some articles, so I can actually talk to you in 10 different ways.
Right.
And don't like make it weird. Like that's just the best way I can think about it. Is like it's really it really does stem from like I said earlier, the relationship you pre-established. Because
Right.
if you have a shitty relationship already, it's gonna be very hard to be there for them. Because
Right.
they might not even want you to be there for them, as shitty as that sounds.
Yeah, that's true. After hearing your tip, it makes me wonder, like, what do you do when you see that I'm in the throes of an anxiety attack or a panic attack? Like, like, the reality is there's nothing that can be done, right? Once I'm in a panic attack, it's literally gonna run its course, and there's nothing anybody can say or do
Right.
to change how it feels. But what do you do to, kind of not deal with it, but work around it because it's happening. There's nothing you can do. Like, what do you do?
So a lot of it, I start usually with how my mom and brother interacting with you. If they are overstimulating you, like talking to you too much, asking a lot, being around you too much, I'll do my part and be away from you. Like I don't need to add on to what's going on, and I'll keep this boy away from you as well, so that he's not constantly jumping on you and scratching on you and stuff like that.
Right.
Now, if they're giving you space, my usually plan is to just go over and not so much, bombard you with things to say, but if you're watching a movie, I'll just make little comments and start conversations with you so that you stay grounded. And I let him go on to you so that you can, pet him and kind of just zone out while you watch the movie and, are just petting him and he's just sitting on you.
Right.
Because when they're talking to you too much, he gets excited. So when they're not around, he can just chill out and sit on you. And like That's specific examples for the movies, but at the dinner table, I would just make jokes, or like when we're out, I would just make small jokes to kind of like. My first assumption is that you're in your head about things, right?
Right.
Especially with the look on your face, I can kind of tell how deep into your head that you're going, and how bad it's getting. So depending on the level that it's at, I sometimes will make jokes to kind of like bring you out. I won't, try to have full on conversations with you because then that would just overwhelm you. But I'll make little jokes and like try to do my best to like draw you out without pulling you out.
Okay.
Let's like lure,
Right.
like fishing. Maybe I've only gone fishing one time. I don't know if that's a good example.
Well, this has been a great conversation, baby, and I want to thank you for giving me your time, and giving the viewers your time.
I feel like I talked a lot.
I mean, that's what we're here for. Like, we want to give good examples of conversations because hopefully our viewers will be able to take some of these conversations and use them as well in their own home to, help drive those conversations. As usual, if you do have any questions or topics that you'd like covered on living with anxiety, panic, and PTSD, please send an email to empanic2021@gmail.com. If you believe you are suffering from a mental illness, please reach out to a mental health provider and start getting help. And if you think you're in crisis mode, dial 911 and ask for immediate assistance. Remember, we are not alone. Thank you, and we'll see you soon.